Hi, I'm Emily, and we're going to talk to you about treating your epilepsy and moving from your pediatrician to an adult doctor. I'm guessing if you're like me, most of your healthcare decisions have been handled by your parents. Sure, you go along for the ride and are the one who gets poked and prodded, but for the most part, it's your parents calling the doctor to make appointments and filling out your prescriptions. Well, guess what? We're getting too old for that. Time to take control. And I know that may sound annoying, and it's true that the transition process from a kid doctor to your future doctor can be confusing, but it's manageable once you know the steps. The whole process is called healthcare transition. So basically, a healthcare transition is the process of getting ready for healthcare as an adult. And lucky you, teens with epilepsy go through this transition multiple times, not just moving from your pediatrician to an adult doctor, but also doing a similar thing with your specialty care doctors like your neurologist and epileptologist.
Well, we've talked about in the past at previous visits, we've talked that as you're getting older, we want you to sort of direct your care, and we want you to feel more comfortable coming to visits to talk to me about concerns that you have, also updating me with how you're doing. So, how have you been doing?
Pretty good.
Okay, and you're taking your medications, correct?
Yes, I'm taking them when they need to be taken.
It is normal to feel overwhelmed with the idea of healthcare transition. Here are some E's that will help you transition with ease. Explore, equip, and execute. And don't worry, you won't have to do all these steps at once. It's a better idea to break it down into chunks that are easier to accomplish. So let's talk about the first step. My friend Chase is ready to dive in on the first E, explore. Basically, this is learning about what to expect from your healthcare transition. Take it away, Chase.
Thanks, Em. The first E is explore. There are 3 things to remember. Number 1, your doctor's visit is all about you. So go ahead, ask a lot of questions. You know all those questions that pop up in your head right before you fall asleep? Now is the time to ask them. I like to write those down in my notes section on my phone so I don't blank out when I'm sitting there in the doctor's chair. Then I write down the answers too while I'm in there, in case I second guess myself later. Also, make sure your doctor is talking to you, not just your parents, cause hello, you're the patient there and it's your body that they're talking about. Number 2, new questions from your doctor. So this is interesting. As you get older, your doctor may ask some different kinds of questions. Personal questions, like whether you use drugs or alcohol or feel depressed. It may feel embarrassing, but it's important to answer honestly so that they can best treat you. Also know that once you turn 16, you have a legal right to talk to your doctor alone. So if it makes you feel more comfortable, ask mom and dad to wait in the waiting room. Number 3, your appointments may feel different. Your adult doctors may not have as much time to talk to you as your pediatrician did. They are rushing from patient to patient. That's why it's important to be prepared for your appointment. Okay, vocabulary quiz time. Let's make sure you understand some common healthcare words that you'll hear floating around. Number 1, age out. So whether you like it or not, you can no longer keep seeing your same doctor or receiving that service once you age out. This happens at different ages for different services, but we'll start around age 18. And hey, I'm guessing you won't miss hanging out with the coughing, runny-nosed kid by the fish tank in the pediatrician's office anyway. Number 2, primary care physician, or PCP. Your PCP will be your main doctor that you visit for regular checkups. They can do anything from annual physical exams to helping you get through the flu. Other doctors you may schedule appointments with are neurologists, which is a doctor who specializes in the brain and nervous system, an epileptologist, which is a neurologist who specializes in treatment of epilepsy. Number 3, prescription. I'm sure you've heard this word before, but now that you're going to be the one in charge, you'll need to learn how to fill and refill a prescription and go to the pharmacy counter and pay for the medicine. Your doctor will write a prescription so the pharmacy knows you're allowed to take this medicine. Number 4, medical history. Your medical history lists all the medical conditions that you've had in the past and what medicines or treatment you took for them. Your doctor keeps track of your medical history at their office, and you can also ask to have your own copy.
Have you had any blood work recently?
Not
Just look at your
off
levels.
the top of my head.
Okay. Well, we'll look in the record and see when your last blood work was. Let's take a look at that.
Like everything else in the world, medical history is moving paperless. Electronic medical records will now house the majority of your info. Talk to your current doctor about how you can transfer your records to your new adult doctor. Also, it's important to note that not all hospitals can easily transfer records to one another, especially if the hospitals are owned by two different companies with different technology systems. If that's the case, ask for a good old-fashioned printed hard copies of your records. Number 5, insurance card. This is exactly what it sounds like. A card that you carry in your wallet that has all your insurance information on it. You may need to call your insurance company and request a card be sent to you so that you can have your own copy. You will always need to bring this with you to your doctor's appointments. The card has the name of your insurance company on it and your policy number, so the doctor's office will know who to send the bill for your medical care. Okay, the vocabulary class is over, but if you don't understand something, just ask. You will probably come across other new words too. Don't be afraid to ask your doctor or parents what they mean. Remember our 3 E's? Well, we're done with Explore, which was the first E of transitioning with ease. Now let's move to our next E. Back to you, Em.
Our second E is Equip. Let's get you equipped to navigate the adult healthcare system. The first thing you'll need to do at your new doctor's office is fill out some forms. Well, probably a lot of forms. Some doctor's offices will email them to you ahead of time or tell you to download them from your website. Others will give you paper forms while you're waiting in the lobby for your appointment, so make sure you arrive 15 minutes early to fill everything out. What will be on these forms? I'm glad you asked. You'll fill out your contact information as well as your emergency contact's name and number. You'll need all of your health insurance information, so make sure you have that handy card with you. You'll also need a list of the previous doctors you've received care from, so have their names and numbers saved in your phone too. You'll need to tell the new doctor which medications you currently take, what are the doses, and why you take each medication. So you may want to bring the prescription bottle with you or take a picture of the label with your phone. They'll also ask if you have any allergies, and it's especially important to tell them if you're allergic to any medications and what reaction you get. You will need to know your own medical history as well as answer basic questions about your family's health. Usually they are just asking about your immediate family, sometimes including your grandparents. Finally, you'll probably have to answer questions about your general health, past seizures, and if you had any previous surgeries or procedures. It would be helpful to have the dates if you've been previously hospitalized, and if there are any reasons why certain procedures or surgery should be avoided. It's okay if you don't know the answers to all of the questions on the form. You can leave something blank or ask your parents or doctor to clarify.
And last but not least, our last step of the healthcare transition process is execute. During this stage, you will use your new skills and knowledge from the first 2 steps to move from your pediatric to adult doctors. The first thing you should do is work with your parents to make a transition plan with 2 important dates. Write them down in your calendar. When will you talk to your current doctor, and when should you plan to see your new doctor for the first time? To execute your transition, you need to learn about 3 important things: HIPAA, insurance, and choosing your new doc. What is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA is a federal law that protects your health information. It keeps things private for you. Insurance. Before you turn 18, check what age your current insurance plan coverage will end and apply for adult health insurance. You can get your own insurance a few different ways: employee benefits, your parents' coverage through their work or your own coverage through your work, campus health plan, private plan, Medicaid, and Medicare. You should also begin to learn about your insurance benefits. Insurance benefits describe what type of insurance plan you have and what will be covered, which means what they will pay for versus what you will be responsible to pay out of your own pocket. Because healthcare can be very expensive, it definitely makes sense to try to pick doctors that are considered in-network. A doctor is in-network if they have a contract with your health insurance company to provide you care. The opposite of in-network is out-of-network. You may still be able to see an out-of-network doctor, but you should call your insurance provider first to see what is covered and how much you would owe for that appointment. Learn your insurance benefits. Your health insurance company will give you a policy book that will contain many FAQs. The most important things to find out are if you need a referral from your doctor to see a new doctor or specialist, if the insurance company will pay for equipment to be fixed or replaced when necessary, if you need pre-authorization for certain medications or hospitalizations, the appeal process, and how to use it if you think your services have been denied in error. Keep track of all your insurance information where you can easily find it. When you call your insurance company with questions, it may be a confusing conversation. Insurance is very complex. The best thing to do is write down what they say and ask the rep to repeat it until you understand. It's a good idea to keep track of all phone calls by writing down the date, who you talked to, and what was discussed. That way it will be easier to follow up if there are any problems. This last one is a big one. Emily, can I tag you in?
You bet. How to find adult providers. Finally, you're ready to pick your new adult doctor. You should talk to your current doctor because they may already have a good plan in place to help you with your healthcare transition. They are also one of the best sources for referral to a new doctor. They are living in a doctor universe every day, so they will have a good idea of who the best doctors are in your area to recommend to you. Other ways to find a new doc. Consider your parents' doctor, check with local support groups, ask your care coordinator or case manager if you have one, ask friends for suggestions. You will then need to call the new doctor's office and ask the receptionist if the doctor is accepting new patients and double check that they accept your insurance. Then tell them you want to make an appointment. Okay, we're done. Hopefully this helped you better transition with ease. I know you're going to do a great job with exploring, being equipped, and executing your healthcare decisions. Remember, you don't have to do all these steps all at once, and there are people around who can answer any questions you have. Good luck.